So this, I have done one of these as a trial to make sure this is all going to work. I did do it on the mobile. It's lupus. I did do it on mobile. So this is my first time trying it out on the computer. So yeah, let's see how we go. So the patient is a walk-in, and the triage nurse reports basically what we have just read out. So it is time for us to assess the patient. She is clearly grimacing in pain. So this case codes AI patient dialogue. This works really quite well. So I'm quite I'm quite looking forward to actually using this. So the patient appears uncomfortable. We can see that, and is GCS 15. For those of you not in the know, GCS stands for the Glasgow Coma Scale, and is a way of assessing how conscious and responsive somebody is. So GCS 15 is the highest score that you can get to. So this is all pretty good. What we're going to do is we are going to start by checking some observations. Okay. So looking at this, we are we've basically got a low-grade fever with a temperature of 38. Oxygen saturations are good. Rest rate is high end of normal, but still normal. Our pulse is tachy, and our blood pressure is normal. So this is the signs of somebody whose body is struggling, but not catastrophically so. This isn't a critically unwell patient, so for this we're not going to jump to rapid assessment, rapid treatment. We're going to, we're happy we can slow things down and take this as it comes. So thank you for seeing me. So apparently there is a dictation function, but I'm not sure. I'm not actually sure how to access it. Okay, so thank you for seeing me. So I'm gonna say I understand. I understand you have pain. Can you tell me more about where it is? So it's pain down low on the right side of the pelvis. So not even abdomen. It's below that. So yeah, it's quite far down. So one of the tools that I'm going to use just now is a tool called Socrates, which is a way of assessing pain in a quick but consistent way. So it's abbreviation. So S stands for sight. O is onset. Okay, when did this pain start? So we think about 2 days. Started about 2 to 3 days ago. Another thing that's relevant in this question is what were you doing when... Can you make guesses? Yeah, you can absolutely make guesses in the chat. What were you doing when the pain started? Were you moving or at rest? So the next letter is O, which is, yeah, onset. So we've asked about what time it is, and also what were we doing when it started. You weren't really doing anything special, it just started hurting. Okay, I'm going to assume that means that we're at rest. Our next thing is character. So what kind of pain is it? So what we're looking here, is it like a throbbing pain? Is it a sharp pain? It's a constant aching pain, like a 10 out of 10. So that answers our final question, which is severity. So SOC R, R is radiating. So does the pain radiate anywhere else? Kidney stones is a good shout. Kidney stones is a good shout. Yeah. On the right side, my first thought, lower right side, is maybe appendicitis. That's what I'm thinking at the moment. But also it's pelvic and we are female, so we also need to consider about the kind of the reproductive track too. So there might be some things in there. No, it just stays in that spot. Okay. So do you have any other symptoms with the pain? So after radiation is basically A, which is your associated symptoms. So we've been a little feverish, so hot, cold, so fever, and we do know that we have a fever, so that kind of ties in with this. Fine. T is timing, so we're going to ask, is the pain, or does it come and go? Constant. We did actually already answer that earlier, but yeah. So it's a constant pain. We next move on to the what is effectively going to be the last letter, which is E. There is an S after it, but we've already answered this, the S, which is severity. So the E is exacerbation. So is there anything that makes the pain better or worse? So it doesn't get any better with position changes. Okay, so we're going to probe that a little bit more. Is the pain worse when taking a deep breath in? Okay. So if the pain is worse when you take a deep breath in, it can imply a kind of issue with like the respiratory tract. That might be the source of where the infection is. Also, you know, because when you breathe, your diaphragm moves around quite a lot. It can kind of, you know, it can also make abdominal related conditions feel a bit worse as well. Okay, and does the pain get worse when you press the area? So is it tender? Yes, it hurts more when you press on it, which is a bit of a misnomer. This is one thing, you know, if you say you've got 10 out of 10 pain, 10 out of 10 pain is the worst pain you could possibly have. If it has the ability to get worse when you press it, then it's not a 10 out of 10 pain. Do we know if the patient has their organs mirrored? What, situs and vertus? That's a rare one, Mono. Okay, so it is tender when we press on it. Okay, fine. Okay, so our next step is, can we give you something for the pain? Yeah, that would be nice. Okay, right, fine. We've done our Socrates at the moment. So Socrates is very specific to pain. We're going to move on to what's called sample. Now we already have an idea of the symptoms. So A, we're going to go for allergies. Do you have any allergies? So before we give medicines, we need to know if the patient has any allergies to any medicines, because we don't want to kill our patient. You know, that would be no bueno. No, we don't have any allergies. Do you take any regular medications? You take a pill for the mood and one pill for herpes sometimes. Okay. Now there's different kinds of herpes. There is genital herpes, there's oral herpes, possibly others, I'm not that clued up about it. But if, genital herpes, this could explain a little more about the, any issues that we have with the genital tract. Okay. So, let's see, for past medical history. Oh, hang on, no, actually, one more question about the medicines. Have you taken anything for the pain already? I love how interactive this is. I know it's AI generated. Okay, we've not done anything for that. That's fine. I know it's AI, but it's quite well done. This feels pretty realistic. I have to be honest with you. No, we haven't taken anything for the pain yet. That's fine. So what we're gonna do then is What is your past medical history? And we've got one more question. Depression, anxiety, and PTSD. Have you ever had a pain like this before? Okay. So we've got some mental health conditions, but no physical health conditions, and we've never had an episode like this before. I think before we do anything else, we are going to go into interventions, and we are going to give analgesia. So for us in the UK, acetaminophen is effectively paracetamol. We will give this. So we'll give some paracetamol and see how we go. And we are going to continue. So our differential at the moment. So let's see. So if we look at genitourinary, if we say, yeah, okay. So kidney stones are definitely one. I've got low suspicions about kidney stones at the moment, but this is definitely one differential. Under gastrointestinal, I'm going to put down appendicitis as a differential. And then in terms of what we're dealing with here, let's go to obs and gynae. So I think ectopic pregnancy is something we can't rule out at the moment. Ovarian torsion, twisted and cuts off blood supply. Okay, that definitely seems like one it could be. Endometriosis is another one that came to my mind. Yeah, okay, so we've got 5 differential diagnoses at the moment. Let's see if we can't rule that one down. We don't really need anything here. So what we'll do, I don't have any airway concerns. We'll do a breathing, yeah, okay, because that's a visual thing. So this is fine. Pulmonary exam. Okay, abdominal exam is the one that we want to do. So perform an abdominal exam. So we've got right lower quadrant tenderness with mild guarding, with no rebound, but the abdomen is soft with normal active bowel sounds. So this means we're not looking at like a blockage of the colon at all, but we are definitely kind of in pain. Let's have a little look at the genitourinary. Moderate white vaginal discharge with cervical motion tenderness and tenderness in the right adnexa. No bleeding, fine. So this, I think, is going to I think this is going to possibly suggest. Oh, I don't know about that one, Mono. I do not know about that one. So I think this finding here is going to suggest that we are probably looking at something in the within the reproductive or urinary systems. But nevertheless, we'll do a back and flank exam, because one thing you can do for like kidney infections and things is like a percussion of the back, and if they fucking cry out with the percussion, there's a good chance that they have got some kind of infection in their kidney. No tenderness of the thoracic or lumbar spine. Fine. Let's just do this one. So there's no cyanosis or edema, that's fine. Warm, dry, no rashes, fine. I've got no indication for a neuro or psychological exam at this time. Let's check in with the patient and see how the acetaminophen is helping. How is the pain now? It's better now, but still hurts. Do you want more pain relief? Yes, that would be good. Okay. This would be morphine. This would be morphine and would involve putting a needle in your arm. Morphine can make you nauseous. Is this okay? Okay, so she's happy with morphine. We've explained. Is the passing of time relative? Does it take effect instantly? I don't know about that one. I don't know about that mono. We'll keep an eye on that and see. She is okay with getting IV. So let's go to the stabilize section and insert an IV. I don't know why it's in stabilize, but there. So we've now got an IV in our arm, which is going to allow us to do a morphine bolus, which is now completed. So we're probably going to see this take effect over time. She does look like she's grimacing a lot less, which is quite good. Okay, fine. So I've got low suspicion for kidney stones. Okay. Bedside tests. Okay, let's have a little look. So let's queue up some blood tests. So we'll do an ABG, a chemistry. I want a CBC and a lactate. Oh, urinalysis is going to be good as well. Okay, so we're going to do some blood tests, and then we are going to do some urine tests as well. So let's see what we're working with. Okay, so all of the things are back. So we'll start at the bottom. So the blood gas shows normal oxygenation, normal carbon dioxide, and normal acidity. Well, high end of normal, actually. But still normal, that's all fine. Blood glucose is fine, creatine, fine. Bicarb is up. Sorry, bicarb is down, which is a bit of a problem. And white blood cells are up significantly. So when your white blood cell count shoots up like this, this is a good sign that you are fighting off infection or inflammation. The lactate is normal, which means we're not seeing tissue breakdown as a result of this inflammation. So this is a picture of somebody who does have infection, possibly inflammation, possibly infection, but again, they are not critically unwell. Yeah, could be pregnancy, although you would be unlikely to have this much pain this early on, which is why I've put down ectopic pregnancy as one of the differentials, because that would cause pain, like this amount of pain this early on. In terms of the urinalysis, everything is fine for that one, so that's all fine. Let's look at our other lab work. So let's get a CRP, a cervical swab. Yeah, we'll get some cervical swabs, lactates. Trying to see if there's anything else. So I've got no sign. So I'm not going to do any further here. I don't think I'm going to remove the. I'm going to remove this for now. Okay, let's perform these tests and see what we're working with. So the CRP is raised, which is a very big indicator of... okay, alright. Okay, so we do have genital infection. Right. So we've got gonococcal infection. And we have gram-negative diplococci present on the cervical swab. So we definitely have some reproductive things going on. Let's see, let's get as well, let's do an ultrasound of the pelvis and see what it is that we're working with here. You typed that when you were selecting the bud test, yeah. So, I do not know how to interpret ultrasounds. That is way beyond my scope. But the interpretation is that there is a fluid-filled structure at the junction of the right ovary and the adnexa, measuring 5 by 3 by 4 centimeters. Differential would include an ovarian cyst versus turbo-ovarian abscess. Suggests clinical correction. Okay. Fine. So I think I think what we're looking at here is the picture of somebody who has some kind of right, hang on, how do I do this again? So let's go to this. So what did we say? We said turbo ovarian abscess is an option and ovarian cysts. And a turbo ovarian abscess. Okay, most commonly occurs due to the progression of untreated genital infections, often sexually transmitted infections. So I think the TOA is probably our most likely culprit here. Because we know that we definitely have this. Is there any other things that we can do? So, I don't care about sugars, I don't care about ECG. In theory, I could because our heart rate is tachy, but I don't think our presentation is, you know, we've got a confirmed infection, and our numbers are in keeping with an infection. So let's this isn't cardiac, so I'm quite happy with that one. Could do CT. So I don't know what the difference between these two is. Let's try this. Yeah, okay, it's okay, it's literally the same. It is literally the same. Okay, let's go for okay, hang on. Let's see what we're dealing with here. How is the pain now? Okay, our pain is much better, and we haven't responded negatively to the morphine, which is quite good. So I think what we're going to do now is we are going to communicate with the obs and gynae team and see what their suggestion is. The presentation is consistent with PID and probably turbo ovarian abscess. You'll take the patient to the OR for investigation and possible drainage. Make sure to assess pre-ops labs and start antibiotics. We will consent her shortly. Okay. Fine. What the fuck is PID? I'm gonna have to Google that one. PID. Oh, pelvic inflammatory disease. Bacterial infection of the female reproductive system. Right, okay. Fine. So, yeah. So, we'll put that one in. I think we can remove this one. So, we've basically got two things in play at the moment. I'll take the patient to the OR for investigation and possible drainage. Okay, so let's tell the patient what's happening first of all. It appears you have a cyst. In your reproductive system that will require surgical investigation. Sir, I misspelled that one. The specialist will be down soon to speak to you. Let's see what this does. What does this mean for you? We will get you started on how do I spell whether? Whether you need surgical procedures. Can I start you on anti? Yeah, that sounds good. Okay, fine. Alright, so what we're gonna do then, let's have a look at antibiotics. Oh god, okay. Oh fuck. This is where I am unfortunately reminded that I am not a fucking doctor. Pharyngitis, okay. Fine, we don't have a fungal infection, so that's okay. Ampicillin. Yeah, okay. Azithromycin. Okay, azithromycin might be the one that we go for. Fourth generation antibiotic. Hospital-acquired pneumonia. Google it? Yeah, well. Cefotaxime. Pneumonia, gonorrhea. Diverticulitis. Doxycycline. Fucking hell. Yeah, this is honestly where I remember that I am not a doctor. And certain genital infections, okay. Metronidazole. Ah, okay. Metronidazole. Yeah, okay, we're good. Metronidazole. Okay, let's get started with metronidazole. Just now. And then we need to get lab work. So I don't actually know what blood works you do pre-surgery. I'm trying to remember what I used to order. Because I used to be a surgical coordinator, but I was non-clinical, so I didn't order blood tests, although I very occasionally was involved in it. I think a coagulation panel is one. A blood screen and type is definitely one. D-dimer, I don't care about. Lipase? What's a lipase? Okay. No. We don't need that one. Liver function's fine. Phosphates. Yeah, okay, I think I'm happy with that one. So we are O positive, and our numbers are all okay for the coagulation panel. So I think it's time for us to hand off this. Oh, jeez, okay. So I think we're going to go for here. So OBS. It will take the patient to the OR for investigation and possible drainage. Okay, so we're going to hand off the patient to the operating room under the OBS and Gynae service. Deep breath. Let's see if this is the right thing to do. Are you sure? Finish. Oh, it does give us a score. Okay, we only got 62% for the investigation. So the ABG was unnecessary. So in my line of work, which is emergency care, everybody gets an ABG. Everybody gets an ABG. Okay, we did that one quite well. The answers we could have done. A pregnancy status. Yeah, okay, actually that would have been quite good. You need to do a pregnancy test to rule out an ectopic pregnancy. Okay, that's my bad. I did serum HHG and a urine HCG. Okay, fine. I thought that was covered in the urine tests, so fine. I wouldn't have very cared about the liver function test, really. Okay, to be fair, I did this one. I think I actually did pretty good in this one. Yeah, I thought the urine test that I did covered pregnancy, but evidently not. So that's my bad. But yeah, okay, that one's we did pretty good in that one, all things considered. How was the patient AI on this case? Oh, it was, yeah, the patient AI was perfect. It was absolutely perfect. I really enjoyed that one. Okay, that was really good, actually. GG, yep, that was really good.
Could go easy on the team kills. Just saying.
Oh my god.
Are you fucking serious?
Where the fuck did they get there?
What's happening?
Ow, what the fuck? You fucking bitch!
Oh, here he is. Ka-chow!
Get your dilly vegetables.
Strawberry isn't a vegetable, you fucking mortal!
Let's go! Come on! Yeah! Oh!
But I'm looking down to plant the bomb.
Yeah, but he could. Okay, okay. Just because you can't see him. Oh! You can say if you want to, you can fuck a hooker. Are we ready for the flesh?
Are you ready for Tony Hawk's pro flesh tunnel?
Throttle down, throttle up.
You don't wanker. Okay, I'm
Oh! Fuck!
What does the army say?
Fuck.
Fuck.
Ah, fuck!
Ah, fuck.
Oh yeah.
I literally can't move.
I'm spawned in the barrel of water.
You're really fast, and I am very good with ropes. That came out badly. Shut up.
We waited all this fucking time for you to download the game! And you fucking get yourself banned!
Doesn't hit as hard as life does.
Jesus Christ, that was
Okay.
deep. Who hurt you?
Shit.
Say the word exterminate.
Just up, down there, right behind you, up the stairs. There we go.
No, that's my character! Oh, I got it, I got it. Ah! Fuck! Fudge! Oh lord, he's right there! What? Stop the zombie apocalypse, I want to talk about paddle steamers! What are you doing, aircraft? Fuck, I'm dead. Not good, not good, not good!
Why is it a planter in the fucking hallway?
Well, because that's where I'm gonna do my fucking plants, isn't it? Come cannon! Fucking die!
But he took. Oh, like this. No, wait, that's not right. Choity toity woities. That's.
There's a cooker! Oh lord! Oh yes! I shuriken the lights out of that!
Why have I been sent to prison?
Oh, holy fuck! That motherfucker just sank the bus. Do you have any idea how many broken bones you have?
I'm a jellyfish.
Fuck! Fuck! Fucking dumbass.
God damn it!
Absolute fucking.
Why did that not go through?
Cause you suck. What the moon doing? Bitch, I can't be outnumbered. I don't know how to count.
That's a fucking threat.
Then beat them the balloon. I thought you were gonna hit us up with the Roger Roger in that voice.
Roger, Roger.
Speed sign. You... Fucking hard mode.
Ah, you bitch!
Ah, okay, that's no bueno. This is no bueno. This is very no bueno. All right, let's just abandon.
Surprise, motherfucker!
We can break this with all the people inside. Oh, fuck yeah, we can. Fuck yeah.